Here we are with Philip for the third session. Last time I treated shoulder and this region here included the knee. Today I will perform the same test I did last time just to show you how different it is. Okay, Phil, can you please bend on this side now? Okay, now look at this area here, how it bends. Okay, and the other one. Now look at this side. It looks completely different. It looks more stuck. The restriction is on the bottom, to be honest. Can you redo it again, both sides? Here, you see the pelvis moves this way and this way. It's completely different. The pelvis basically twists. Okay? So this part can bend. This part, it cannot bend, so the pelvis twists. Twist this way. Okay? It's very visible. You can compare this video with the beginning of the second treatment and you will see definitely a difference. As I showed you at the end of last session, now definitely there is an injury on the foot. On the left foot, because he had an operation, there was a kind of growth in the bone and they have to cut the Achilles to clean it, let's say, a cleanup. Okay, please lie on your back. This is the place in which there's been the injury. Last time when we started, the foot was like that and then it relaxed a lot. Now, one of the tests that any therapist can do to understand if there is an injury more on the left or on the right is this one, is an external rotation of the hip. Because if you have an injury connected with the top part, it will anyway affect the lower part and your hip will never, your pelvis will never be able to move properly. So if you grab the leg and you go in external rotation, it has to be, obviously, you need to have movement. This is the injured side, okay? This side, there is no movement at all. Now, I usually am like that and I do this. 1, okay, and 2. Here, there is no external rotation of the hip. Obviously, it's not the hip itself the problem, but as I showed you last time, when I lift this side now, there is movement. When I go to the sacrum here and I try to lift, okay, it's a lot heavier. Already checked, sacrum and foot, there is a compression. A compression is an irritation of the nerve, which you always have following an injury or an operation, car accident, things like that. He had 7, 8 bike accident, so at some point I will need to treat all the spine as a whole together, okay? It is not the case today. It's very clear that the problem is there. Phil, you will tell me about headache and blurred vision, okay? We didn't discuss this on video before, but what happened about blurred vision? Can you tell what you were feeling before and now?
So when I started, first half hour of the day, I couldn't focus properly on anything. Everything was very blurred and I'd basically have to sit still for 20 minutes to half an hour before it cleared. That's all gone, and since the second treatment I haven't had another headache, which I was suffering from before. They would come in very rapidly and then would last for about 5 minutes and then disappear completely. They've all gone.
Okay, so the connection high, what improved obviously is the neck. The neck contains on its own nerves that control two main muscles that are inside the eye. So we have muscle inside the eyes and this muscle basically controls the lens. So inside the eye we have a lens and to put on focus the lens needs to change the shape, okay? This muscle basically have the control from the neck. So he had massive restriction on the neck, both sides mainly. One side was more, it was more this side at the beginning. Now definitely things change. It's still stiff because everything affects everything. So the injury there will anyway restrict more this side now, okay? So this side more or less moved, and this side, you think it's more stuck. If you look at this test in a previous video, it will be the opposite. So So before, this side was moving well, and this side was stuck. This tells you again that the body is all connected. You treat something on the left improves. The right, if it has an injury, it will get more stuck. So you need to get rid of injury to make your spine be more flexible, and then you can say you are fixing things. Okay, otherwise you will continue to manage, and you will accumulate things like blurred vision, like headache, and then things will go worse, and you will start not understanding where to start in case of treatment for other things. Also, all the organs obviously have the innervation on the spine, so the spine needs to work. Okay, the eyes is an organ, neck, and this is how the neck works. There is more mobility now on the right. It's still painful, okay, because it's not enough. But definitely there is more mobility on the right side. Obviously, the left will be more stuck. Overall, the mobility is improved, and is proved by the fact of this improvement in terms of headache, and especially in the eye. So if you have blurred vision, you don't need to look at the eye. You need to look at the neck. Okay, just mobilize the neck. You can try to do some exercises for the neck, but it's better to do a proper test and a proper release, because the neck is under the influence of whatever. You can tell the foot is completely different. Before was like that, and this one improved with the shoulder. So now this side more or less seems okay. That side is definitely the injured one. So if I do additional test, okay, eversion, inversion of the foot, there is a kind of mobility here. Now, here is very stuck. The eversion is very stuck. The inversion is okay. Okay, so he had an operation around here. Any kind of operation, even if you've been in local anesthesia, the anesthesia doesn't rate how bad is the operation. Okay, so a lot of people think, oh, it's been a local anesthesia, it wasn't a small operation, but it's a trauma, and your body definitely remember about it. Now, I want to do some other tests while I treat him. The treatment, it will be S1, so the sacrum, because this region is L5 S1, and this. So I will be like that for whatever it takes. Okay, maybe 30 minutes or more. You can tell there is a difference here. Now, the pelvis is more this way, is more restricted this way. This part moves better. There is a rotation. When he was walking after the last session, he felt completely strange. Yeah, you always feel strange after here. Okay? Yeah. And he was, on a couple of occasions, he almost tripped because the body was working completely different. He trains a lot, and he noticed that the muscles are working completely different. So now they have different muscles. So before he had pain here, and the neck, plus all these things that improved already. Now he said this part is different.
Yeah, it's not hurting as much.
Okay, this one is not hurting as much. When he trained, he feel muscle getting tired in a different way than before. So definitely there is a change. Now, until we remove everything, the condition is still so-so. Okay, so I don't expect him to improve in one session. Okay, I will close the camera again because we need to put some device. I will explain what we are doing today, which is a little bit different. So the only things that I had today is an HRV monitor. So basically Phil has his finger with a, let's say, heart rate reader. This is the monitor, it's connected Bluetooth with this phone, and I want to check if there is any visible change. While he will be in the moment when the treatment happens. Okay, so when usually the patient most of the time go to sleep. Sometimes the patient go to sleep because he reaches a stage in which the body is completely relaxed and the patient go to sleep. It happened before with him on both sessions. Let's hope it will happen today as well. Phil, can you just move a little bit toward the right? Just a tiny bit. Just a tiny bit. Okay. So we said the foot, this part is very heavy around the sacrum. The sacrum obviously is this bone here on the middle of the pelvis. When you have an injury, it gets stuck on that side. So we are talking about the left side. Okay, let's start. Now we need to find a position which will help me. You also said, he corrected me, he said the operation was on general anesthesia and he got 4 heparin because of it, okay? Okay, so what I'm feeling now. My finger, which is with in the sacrum region. So basically, it's like if the leg, all the leg is shrinking a little bit. I need to find the position of ease. I need to do my magic. Okay. This heart rate variability monitor obviously is not a professional one. The one who are used in the hospital or professional facilities, they cost thousands of pounds. Okay. So I'm still a bit poor to afford that. Okay. There is already a change on the foot. The patient sometimes doesn't feel anything, sometimes they feel a little bit. There are some contraction on the plantar fascia now. There are a lot of contraction. Do you feel them? Probably not. Yeah, do you feel them? Yeah? Okay. Now, the only doubt is, do I need to treat the whiplash? Because he said 7 or 8 bike accident, and those are whiplash, okay? When you have a whiplash, all the injury that you got on top of it, operation, fracture, whatever, they're less visible and they are not easy to be treated. So there is a chance that they need to address all the spine before the foot, but we will try. I will try to record everything today, and then I will do my 2 versions, a long version and a short version. You can choose if you are interested. So if there is a whiplash, which is a spinal irritation, all the spine is irritated. So when you touch the leg, pins and needle, muscle spasm can happen. Which, to be honest, is what is going on now. So I just try to move a little bit my hand to be less irritating for the spine. Let's see if there is a change, otherwise. So at this stage, the pelvis already worked better, not because I treat the foot, but because also this compression on the spine can affect the resistance that you have when you move the spine around. So the caraxion, let's say. There's been some release on the pelvis. The pelvis was moving toward the left in few occasions. Let's see if he needs something more there, or if I can proceed with the foot. Let's say the ankle. Take a deep breath. It looks like the ankle is the one now. So the restriction, it should increase. So now it should increase a little bit more the restriction on the foot. Okay, it doesn't matter. Take a breath. It's quite good. I felt a release while I was treating the spine more on the top. In fact, the neck seems to be more flexible on the left side. There is still some restriction here, but I think it may be enough for today. Let's check. But definitely it moves better. I just need to understand other injury because definitely this guy had so many of them. So what do you do? 34 vertebrae, they can be restricted on the left or on the right or on both sides, depending if it's an operation, depending if you had an injury on the left or on the right. So I just check them all, okay? Very easy. So, some of them, they will be restricted. I mean, the mobility, it's good for a person who had such trauma now. And the fact that it improved the headache, the blurred vision, it means that the body is responding quite well. Okay, here you can tell it's a bit harder. Do you feel this? Yeah, it's the upper lumbar spine. You maybe connect something with the diaphragm. Take a deep breath. The diaphragm expands, so there is no major issue. This part bend. On this side, there is more restriction on the upper part of the lumbar spine. It may still be something from previous injury because now the right side, this part, you feel it? This part is tender. This part moves better this way than this way. On the middle part, on the lumbar spine, lift a little bit the pelvis. Let's check okay? Let's check the pelvis. The sacrum is, okay. Deep breath. So now the lumbar spine is worse than the neck, okay? So the neck it improved a lot. The mobility of the neck since we started improved a lot in this 2.5 sessions. Take a deep breath. Again, he had 2 ischemic attack, let's say what is called TIA, and the TIA, they come from the neck, okay, definitely. Okay, it's enough. Take a deep breath. Okay, so, okay. So, this is the lower part, okay? He had also an injury, he said a pull muscle and hip injury. This part, S1, which is the foot. Okay, not too bad any longer. There is a knee. There is still the knee, which I didn't properly approach last time because then this part was more important. Now makes sense. The knee was a little bit neglected last time. Okay, let's try the knee. Okay, and so if it's the knee, obviously, here there is no movement at all, there is no extension. Also, you see this part now doesn't move. So the pelvis is already in a position where the leg is quite externally rotated, but then there is no additional movement in external rotation. The problem is on the spine. He can feel there is a restriction on this side of the lumbar spine, and his way was the neck. So the neck is improving a lot. The lumbar spine needs some adjustment where he had the injury. In this case, he had injury operation on the knee. Right knee. Lift a little bit your pelvis.
Sorry. Half a sec, what did you say?
Oh, definitely. Like that. Okay, just relax. Relax your leg as well. Deep breath. Deep breath. deep breath. Now, the left side definitely works a lot. The right side has different restriction. It's more, this bottom part of the right side is connected with the upper part of the lumbar spine. So, let's check. Left side is good, but the right side, it will be restricted. You feel? Completely blocked. So the upper right side of the lumbar spine, what it can be? Any injury on the rib, or any operation, even if you remove a mole or whatever.
No, I've had a few kind of bruised and cracked. Well, not. Yeah, I think on this side. Can't really remember.
Okay.
I'm playing rugby, so.
Okay, I tell you straight after. Look, one. Okay, so makes sense. So I'm going around, things are coming out because he had a life full of sport and full of injury. When the patient fell asleep, and he definitely did, it means I'm on the spot. Okay, so all the spine is needed to be treated when you have a whiplash. The whiplash doesn't have to do with the neck, it's all the spine connected. Now the neck moves a lot better on the left side. There is this part suggests, it's not blocked, but it's very restricted, suggests this part is the problem. So there's a very big connection, lower neck, upper lumbar spine. So from the lower neck I can already tell, maybe it's a rib. It may be a rib. If there is a rib, or can be something else. Yeah, the neck basically, the head is doing something like that. He's rotating and he's doing this. Okay? So if I try to pull the back, you feel very hard? This part. So if I try to pull up here and here, this side is a lot more stiff. All this side is more stiff, so if I try to pull, to push the shoulder down, but the restriction is true, it's here.
Yeah, it's there.
Yeah? It's painful.
It was then, yeah.
Okay, so look at this. Just and here.
It doesn't hurt.
It's just very, very, very hard.
Yeah.
Okay, if I try to pull the rib cage, because we can do it on the rib cage as well. Yeah. This side is more tender overall.
There.
So yeah, definitely it may be, you feel, especially here. This one, this part. It's very good. This part, especially this part. It may be a rib injury. So if you play, you played what, rugby? You play rugby, definitely lots of tackle, a lot of injury on the rib. It can be something else that at the beginning it didn't say, but sooner after whatever, it will come out. Okay. Now the diaphragm, just relax, is good. Look at this. I can enter inside very, very easily. It's harder. It's definitely harder. Here, it's completely fine. But it's not the diaphragm its own. It looks like a rib. If it's true, it's a rib, definitely it's on right side. I grab the spine, it won't come toward the left. You feel? This one, it doesn't come. Lumbar spine, so it's in between, the thoracic and the lumbar spine. It should be one of the last rib, right side. Okay, let's keep these things for the next time. The recording has been quite interesting. When I was watching and he was falling asleep, there was some spike in the heart rate variability. What is this thing? So if the heart, it is used the heart because it's the easiest organ to use. If the heart is able to adapt the beat higher or lower depending what you're doing, obviously you don't expect from this position to have a very high heartbeat. When you run, obviously the heart goes up, and the ability of the heart to go up and down and to adapt to what you are doing, it tells how the autonomic nervous system or vegetative nervous system works. Okay, this is everything. Okay, it's not the heart that change, that decide to beat more faster or slower. Is obviously the brain. So the brain adapt and tell the heart you need to go faster. Okay, if the connection is good, the heart will work depending on what you're doing, and this heart rate variability is higher. Okay, it's an index that tell you are healthy. Okay, but you are judging the autonomic nervous system. Okay, now the video has been quite long because, as you can see, you find things all the time. This would have been probably 2 sessions instead of 1. A session usually lasts an hour, but I like to record everything as it is because it's interesting to find things, to see how things change, to see the patient that fell asleep when I'm on the spot. And now definitely next time I will consider the rib. He confirmed he had quite a few injury on one side. There was probably some bruises, something that you saw. Definitely a person that play rugby has a lot of injury on the rib. Thanks for watching.